Let's bring in Dr. Jane Morgan, Executive Director at Piedmont. So this is a fact. We're seeing this. More people are opting to do things medically to not have a child.
This is absolutely correct. And we saw that trend really beginning to increase slightly since 2016. But beginning in mid-2022, we saw it really begin to increase in both men and women, these permanent sterilization techniques.
So you saw the increase 2022. That was when the abortion decision came down, leaving it up to the states. But also we're seeing it in a younger generation. What are some of the consequences and some of the reasons why people would do this?
And that's exactly true. This is really data in the demographic of 18 years old to 30 years of age. And some of the reasons that people would choose for having permanent sterilization may be simply just to be child-free, to have a degree of freedom, concerns about overpopulation, economic concerns, or maybe you're carrying a genetic or hereditary disease that you are concerned about passing on. So these are all some of the reasons that people may use for permanent sterilization.
And quickly, when it's that early, what are some of the consequences?
Oftentimes, and maybe often is not the right word, but 25% of the time, especially in women, we do see what we call sterilization regret, where they experience some regret as they get older in having this technique at such a young age.
Again, something to think about, so many reasons, but the reality is we're seeing more of it. Dr. Jane Morgan, Executive Director with Piedmont. Thank you.
Thank you.
I got some more numbers for you now. A 2022 Harris poll found two big reasons younger people decide, look, I'm not having kids. 70% of millennials say they like the freedom, something a mother of two can understand. And then 61% say they just can't afford it right now. But you made a great point.
You can never afford it. If you wait till you have $1 million in the bank, you'll never have children. So just go on and do it.
And again, two people have to be on the same wavelength.
Do they?
Well, maybe. You have two grown kids. Would you like a third grown child?
Yeah.
Perfect.
Come on.
Done.